So, now you have survived nursing school, passed the NCLEX, and landed your first position as a new graduate RN. It seems like you're on top of the world. Then, reality sits in, as well as the stress, intimidation, and self-doubt. A new graduate nurse's first job is often referred to as a bit of a reality shock. What is reality shock? Reality shock is a slang term used to describe the adjustment of a new nurse to nursing practice. When a new graduate nurse sets out in their first nursing position, it can be exciting but very overwhelming. It can also be very challenging. Reality sets in that human lives are on the line in an often unfamiliar, new, fast-paced environment. High acuity, fast turnaround, and the needs of patients can overwhelm new nurses. There may be an abundance of new equipment, new computer systems, new protocols, and new coworkers. This puts high levels of stress on new nurses, which can lead to self-doubt and uncertainty with one's ability. So how can new nurses cope with this big adjustment? Number one, they can find a mentor. This can be a preceptor, a charge nurse, or even a clinical nurse educator. The best mentors are those who can remember what it's like to be a new nurse and use their skills to shape future nurses. Don't be hesitant to reach out to those around you and ask questions. This may help establish new trusting relationships. Second, it's important to foster strong organizational skills. Organization can decrease stress and keep new nurses calm in overwhelming situations. Develop checklists of to-do lists over the shift and make sure to mark those off periodically throughout your day. After receiving report, look at the medications to be administered that day and note what supplies will be needed and how long preparation will take. And always be prepared. Keep alcohol swabs, IV caps, and flushes anywhere close to you, whether it be in your scrub pockets or in your computer well. Number three, it's important to take care of yourself, physically and mentally. Be well rested prior to your shift. Also wear well-fitting clothes and a comfortable uniform and comfortable shoes. Pack accessible snacks, meals, and drinks for the entire shift, plus some extra, just in case you have to stay late with all that extra charting. Practice stress management techniques. And exercise. I think nursing school taught us all the importance of this. And finally, don't hesitate to contact a therapist or use resources at work for any emotional stress issues if needed. Now, what can you do before you get hired for your first job to set yourself up for success? You can ask about job shadowing. When you're in the interview process, ask about job shadowing a nurse on the unit. This will give you an expectation of what the normal patient load is like and the general flow of the floor. Also, you can look for hospitals that offer nurse internship programs. This is a great way to lower the level of reality shock. Generally, nurse internships are paid programs which may require a commitment to work for a certain amount of time after the internship is over. However, these internships build confidence in the new position and reinforce skills in a structured, safe environment. Now, regarding the hospital unit orientation, you want to make sure to meet with the manager and nurse educator frequently to discuss your development. You want to ensure that you are going to be trained on other units that you may be floated to in the future. And most importantly, if you're feeling uncomfortable towards the end of your orientation, make sure to speak with your manager.